Assalamu alaikum. Naseem Assar here, roll number BP 1650161. The presentation is regarding pharmacy practice PHP 602. My group is number 1 and the topic assigned to me is approach to and assessment of patient therapy. It is taken from chapter number 1, assessment of therapy and medication therapy management. Once the subjective and objective information is obtained, the second step in documenting an MTMS encounter is assessment. The clinicians must assess the drug therapy or drug specific problem. The assessment is the clinician's clinical justification for the plan. Assessment. After the subjective and objective data have been gathered in support of a specific listed problem, the practitioner should assess the equity, severity, and importance of these problems. A practitioner should then identify all factors that could be causing or contributing to the problem. Now, during the initial encounter with the patient, it might be discovered that the medical problem is only a symptom complex and that a diagnosis is needed to more accurately identify the problem and further define its severity. The assessment is usually performed during or immediately following the data gathering while the provider keeps in mind evidence based practices. Drug therapy assessment. The purpose of drug therapy monitoring is to identify and solve drug related problems and to ensure that all therapeutic objectives are being achieved. Nurses, pharmacists, physicians, and other healthcare practitioners share the responsibility to assess and monitor patient drug therapy. Unless proven otherwise, the medical diagnosis should be assumed to be correct. Now, case study. DL, a 36-year-old construction worker, tripped on a boat at the construction site 2 days ago. Sustaining an abrasion of his left shin, he presents to the emergency department with pain, redness, and swelling in the area of the injury. He is diagnosed as having cellulitis. What is the primary problem? What subjective and objective data supports the problem? What additional subjective and objective data are not provided but usually are needed to define this particular problem? Now come towards subjective. The primary problem here is cellulitis of the left leg. As we know, DL is a male aged 36 years having history of getting injured 2 days ago. DL injured his left shin at construction site. He is having problem of pain, redness and swelling at his left shin. He is having possibility of dirty wound due to construction site injury. Now come towards objective. The objective here we have is wound is on left shin. Now assessment. Additional data needed to assess the particular problem. Did he receive booster dose of tetanus toxoid within the past 10 years? How he cleaned the wound after injury. Additional data to obtain and get documented is intensity of the redness on a 1 to 4 plus scale, the size of the inflamed area as described by an area of demarcation, the circumference of his left shin compared with his right shin, the presence or absence of pus or any lymphatic involvement, his temperature, white blood cells count. Now come towards assessment. Since insufficient information is provided regarding patient's history and due to the lack of subjective and objective detail, we can't really assess the case in depth. But according to the provided information, we can assess the patient is having cellulitis in his left leg because of the bacterial infection in the abrasion of his left shin. In this case, treatment plan was not asked, so the case is solved accordingly. Now, the crucial point in the assessment is patient education. Educating patient to better understand their medical problems and treatment is an employed goal of all treatment plans. The level of teaching has to be tailored to the patient needs, health, literacy, willingness to learn, and general state of health and mind. Now, how to treat cellulitis in a fastest way possible. DL could cover his wound, probably properly covering the affected skin will help it heal and prevent the irritation. By keeping the area clean, by elevating the affected area, applying a cool compress, taking an over-the-counter pain reliever, treating any underlying condition, taking all your antibiotics. Now, purpose of assessment. The purpose of assessment is to determine if the patient's drug related needs are being met and if any drug therapy problems are present. Know your patient by understanding his or her medication experience before making any decision about their drug therapy. Always assess the patient's drug related need in the same systematic order that are appropriate indication, effectiveness of the drug regimen, and the level of safety. And that brings us to the end. Thank you.